on Wall Street for you. Let's go back to Debbie and Christina.
All right, Andrew, thank you very much. Well, prostate cancer is the second most commonly diagnosed type of cancer among American men, and African American men are twice as likely to die from prostate cancer as other men. Joining us here is our New York studio to offer some insight on preventative measures against prostate cancer. He is Dr. Kamau Kokayi. He is a doctor with Patients Medical, a healthcare center here in Manhattan. Dr. Kokayi, thank you so much for joining us.
Yes, thank you.
Let's just start with, can you explain the high incidence of prostate cancer among African American men? Why is that?
Well, there are a lot of factors that are involved, but we almost have to step outside of mainstream medicine to understand that. In what's called the German New Medicine and Total Biology in Europe, issues that deal with survival of the species, right, of your relationships with people around you, are factors that seem to contribute to prostate cancer. So all we have to do is just think about what's happening with black men in this country, right? So that's one end. Two is a whole piece around nutrition. You know, how we actually eat. Do we eat nutrient-dense food? Do we get certain nutrition? Third is our use of the healthcare system. Are men willing to go and be checked? Are they going to take those results seriously? What kind of follow-up, or how do they decide to deal with the information? Right.
You talk about some factors that can lead to an increased incidence of prostate cancer. I want to run down 4 of these, and you've already talked about a couple of them. Right. You said stress, poor food choices, as you just said, nutrient deficiencies, as well as the environment. Which of these has the greater impact than the others?
They can all, it depends on the person. It depends on their environment. It depends on their relationships. Ultimately, health is relational. It has to do with your relationship with your food, relationship with family members, your work environment, with the society at large. All of those things can impact on the prostate. And also, the prostate sits at the bottom of the torso, right? So it's what I call a sludge effect, just from sitting constantly. If you're not in motion, if you're not enhancing your circulation through physical activity, that's going to create a problem. Within the cellular environment, I mean, people just don't pop up, oh, I have cancer, even though at least 50% of men now are going to be told that they have cancer at some point in their life. There's a reason for it, and they're what are called cell signaling pathways, right, that need to be modulated or controlled. So nutrients like vitamin E, vitamin D are really key. And then there are botanicals that are very important, right? Botanicals like curcumin, you've probably heard of that. There are other things that have been researched that have shown to modulate these cell signaling pathways to help prevent prostate cancer.
Can you speak to why there is a delay, particularly in the African American male community, in just getting the screening done in the first place? Why
is there a delay? It really has to do with the relationship of African American men to the system at large, right? For many men, as little contact, the better, right? And it's just a reality in terms of how the system can get turned on you, right? With respect to healthcare, I mean, it's well known that with respect to racism, no matter what your economic status is, that has an effect on outcomes. It has an effect on how you're diagnosed and treated. So men are aware of this, and many men with the internet now want to take matters in their own hand.
Are there any environmental relationships? In other words, are men in cities more likely to have prostate cancer than men in suburban areas or men in the Caribbean?
Well, what's happening because of our modern living, our lifestyle, we're constantly exposed to what are called xenoestrogens. These are chemicals from our environment that actually promote prostate cancer. They're in plastics, they're in hormones that are injected into meats that are commonly eaten by people. So if you're not living a whole food plant-based diet that's mainly organic and trying to live in as much of a natural environment as possible, i.e. the city, you're going to be more predisposed.
And the bottom line is important for all men to go get the screening, starting at what age? Very quickly.
40.
Starting at 40,
40.
get their screening and follow their doctor's advice.
Right.
All right. Dr. Kokayi.
Right.
I had
You
it
got
earlier.
You got it.
Kokayi.
We're on it. We're on it.
Thank you very much.
Thank you.
Appreciate it.
All right.
Well, we have the sounds of